The WASH program is one of the most essential environmental health programs. WASH stands for Water, Sanitation, and Hygiene. This program ensures access to clean water, safe toilets, and proper hygiene behaviors for all individuals and communities. It is a cornerstone of public health because water and sanitation are fundamental human rights and critical to disease prevention. When disease is present, it is mostly related to the community's access to safe drinking water and proper sanitation. When they do not have this, the risk of infection significantly increases. Moreover, the hygiene practices such as hand washing with soap and safe food handling protect families from common communicable diseases. Wash is essential for preventing infectious diseases and promoting community well-being. Why is the WASH program important? First, contaminated water can lead to diseases such as diarrhea, cholera, and typhoid. These illnesses remain common in many low resource areas, especially where clean water sources are scarce or polluted. Second, the lack of sanitation, such as the absence of toilets or poor waste disposal systems, lead to environmental communication. Open defecation or poorly maintained septic tanks can contaminate groundwater, affecting an entire community. Third, the poor hygiene practices like not washing hands after using the toilet or before eating increase the risk of disease transmission and could contribute to malnutrition, particularly among children. From a nursing perspective, these are preventable conditions. Through education, community mobilization, and consistent hygiene promotion, we can help break the cycle of infection. The WASH program is guided by three major goals. First, achieving universal access to safe water and sanitation services. This means that every household, regardless of income or location, has access to clean drinking water and hygienic toilets. Second, the reduction of waterborne diseases, including diarrhea, typhoid, and parasitic infections, which often thrive in poor sanitary conditions. And third, the promotion of hygiene practices across households, schools, and workplaces. This ensures that hygiene becomes part of daily behavior, not just a one time activity. These WASH program goals align with the Sustainable Development Goal number 6, ensuring availability and sustainability when it comes to management of water and sanitation for all by 2030. There are three main components of the WASH framework. First, we have the water. This refers to the provision of safe, sufficient, and accessible drinking water. Safe water should be free from pathogens, chemicals, and contaminants. It must also be available in adequate quantities and accessible to all, especially vulnerable groups such as children and the elderly. We have the sanitation component. This means ensuring hygienic toilet facilities and proper waste disposal systems. Sanitation prevents human waste from contaminating the environment. Examples include flush toilets connected to septic tanks, composting toilets, or community managed facilities. The third component is hygiene. This focuses on hand washing, food safety, and menstrual hygiene management. Simple hand washing with soap can reduce diarrheal diseases by almost half. We nurses play a big role in teaching these everyday hygiene habits. In the Philippines, the WASH program is a collaborative effort. It is implemented by the Department of Health in partnership with the Department of Interior and Local Government, the Department of Education, the Department of Public Works and Highways, and the LGUs. The program is guided by the Philippine Water Supply and Sanitation Master Plan, which outlines the country's roadmap toward universal access to water and sanitation by 2030. The focus areas include rural water systems, where access remains a challenge, and school based hygiene promotion, where WASH practices are integrated into education to influence lifelong habits. This multi-sectoral approach reflects the principle that water and sanitation are not only health concerns, but also development and education issues. There are several strategies for implementation of the WASH program. First is through the construction of safe water systems and sanitary toilets in homes, schools, and public facilities. Examples include level 2 communal faucets, level 3 pipe systems, and improved household toilets. Second is installing hand washing facilities in schools and communities. These are often simple but strategic interventions that promote daily hygiene habits. And the third, through the promotion of hygiene practices via health education. Nurses, barangay health workers, and teachers conduct information drives and demonstrations on proper hand washing, food safety, and toilet management. These strategies combine infrastructure and education, ensuring that facilities are not only available but are also used correctly. The integration of hygiene education in the school curriculum ensures that students learn the importance of hand washing, clean toilets, and safe water use from a young age. This is included in the school based WASH initiatives. Schools must also maintain clean toilets and hand washing facilities that are accessible to all students, including those with disabilities. Active participation of teachers and students fosters ownership. When students join school cleanup drives or hygiene campaigns, they become agents of change both in school and at home. At the community level, WASH programs are most effective when the barangay takes the lead. Barangay led sanitation mapping helps identify households without toilets or safe water access. This data becomes the basis for community planning. Community cleanup drives mobilize residents to maintain cleanliness in public areas and waterways. The mobilization of households for proper waste disposal and water conservation reinforces collective responsibility. Lastly, partnerships with NGOs and the private sectors help fund or provide technical support for water and sanitation infrastructure. These collaborations make WASH program sustainable. When WASH programs are well implemented, these are the health benefits. There will be a reduction in diarrheal and parasitic infections, which remain among the top causes of morbidity among Filipino children. Second is improved nutrition and child growth outcomes, which occur because children are less likely to suffer from recurrent infections that affect their appetite and nutrient absorption. Then there is the enhanced school attendance and productivity. This is observed when healthy children miss fewer school days and adults spend less time caring for sick family members. Community health nurses play an important role in the WASH implementation. We conduct sanitation and water quality assessments, identifying unsafe practices and possible contamination sources. We educate families and communities on hygiene and safe water use, using clear and culturally appropriate teaching strategies. And we collaborate with LGUs and schools to design, plan, and evaluate WASH programs that are responsive to local needs. Beyond implementation, SAGENs must also serve as advocates. We advocate for clean water and sanitation policies, ensuring that environmental health remains a priority in LGU planning and budgeting. We support local programs promoting hand washing and hygiene, such as the Global Hand Washing Day, celebrations, or wash awareness campaigns. As we lead campaigns in proper waste disposal and disease prevention, showing that small community efforts can lead to major health improvements. The WASH program implementation faces several challenges. One is the limited access to water and sanitation in remote or geographically isolated areas, especially in mountainous or island communities. Another one is poor maintenance of facilities and low compliance of hygiene practices, which often result in short term gains rather than long term improvement. And there's a need for sustainable funding and community participation. Programs fail when they rely solely on external support. So, how do we strengthen the WASH programs? First, we can enhance coordination among government agencies and stakeholders. Interagency collaboration ensures that infrastructure, education, and health efforts are aligned. Second, strengthen hygiene promotion through community health education. Continuous learning reinforces good habits and encourages accountability. Third, we can integrate WASH into health, education, and disaster preparedness programs. This approach ensures that WASH is not treated as an isolated activity or program, but as a core element of community organization. To summarize our discussion, here is a recap. WASH program is essential for promoting health and preventing diseases. Access to clean water, sanitation, and hygiene is not only a service but a basic human right. We nurses have our close connection to communities and are key partners in implementing and sustaining WASH programs. By empowering families, advocating for policies, and working collaboratively with other sectors, we play and we help the community transform to be more particular with their hygiene, thus helping them become more healthy.